Hi, my name is Angie, and I'll be going over the risk factors for HIV and AIDS in Southern Africa, specifically Namibia, South Africa, Botswana, Swaziland, and Lesotho. I'll also be covering how does culture, the economy, and environment contribute to the spread of HIV in these regions. So to begin with, the risk factors for HIV and AIDS in the southern countries of Africa are transaction sex, prostitution, age disparate sexual relationships, so such as young married women with partners who were 16 years or more older than them were at 3 times greater risk for HIV infection than those with partners that were, let's say, 10 years or older than them. Sexual violence, 2014 UNAIDS assessment of demographic and health surveys carried out in the region suggests that young women face higher levels of spousal, physical, or sexual violence than women from other age groups. Unprotected sex, so the lack of use of condoms. Although knowledge among young women or young people is evolving, only 37% of young women and 41% of young men have comprehensive and correct knowledge of HIV prevention. In addition, only 29% of adolescent women aged 15 to 19 at high risk of HIV infection used a condom the last time they had sex, compared to 44% of their male counterparts. Condom usage by sex workers and their clients varies greatly. In some cases, sex workers have no access to condoms or are unaware of their importance. In other cases, police activity compensate or destroy sex workers' condoms. Birth transmission is another risk factor if the mother has the infection. Child marriage, sex workers, which we've kind of already gone over. In Botswana, more than half of female sex workers are living with HIV. If you're female, you have a higher risk. Men who have sex with men, known as MSM in Africa. Overall, 1 in 3 men who have sex with men is living with HIV in the region. HIV transmission between men who have sex with men accounted for 6% of new infections in the region. And then it was kind of interesting, even though evidence suggests that the majority of the region's men who have sex with men also engage in heterosexual sex, so often with wives or other long-term female partners, the HIV epidemic among men who have sex with men is therefore interlaced with the epidemic in the wider population. People who inject drugs in 2015, an estimated 19.4% of people who injected drugs in South Africa were living with HIV. And then prisoners is another category. It is also due to the fact that prisoners are live in high-risk environments for HIV transmission, fueled by overcrowding, limited access to health care, drug use, unsafe injecting practices, sexual violence, unprotected sex, and tattooing. And then the last risk factor is transgender people.